When children cannot be maintained or reunited with their parents within a reasonable time, efforts are dedicated to provide alternate living arrangements that are most beneficial to the child, which preserve emotional kinship, identity, and continuity. Approximately 900 families receive services from ongoing child protection each year. There is a diverse clientele within DHS, and most of the time we deal with minority families, but it's important to remember that anyone can call in a report to the hotline on anyone for anything, and that's one of the main things that I've learned during my time with DHS. We often see a wide range of family compositions coming through DHS due to the improved awareness of the hotline and services that DHS can provide. Our main function is to assess the abuse and neglect referrals to determine if abuse and or neglect has occurred, and then we work to determine the safety of the children and the parents' care. And when we get a hotline call, we first put the call through a red team, or the referral through a red team, and that's where a group of people sits down and reads through the referral and determines if the allegations in the report meet the Colorado Children's Code for assigning it to a caseworker. I found this graphic on the DHS website, and it shows that annually there's an average of more than 11,000 reports made to the agency, and of Colorado's largest 5 counties, El Paso County has the highest number of assigned referrals than any other county. This means that once a call goes through Red Team that I previously explained, once that's screened, then it's assigned, and we have a higher number of assigned per the Colorado Children's Code. When we have a family that we're working with that needs services, but they can't afford the services, we go through a program called CORE, and CORE works to bill Medicaid for things that clients need due to court orders or treatment plan specifications. Some of these different services that we have access to are individual, group, or family therapy, parenting classes, DV treatment, drug and alcohol treatment, crisis intervention, and often life skills training. My previous work with DHS included learning the ins and outs of the intake side of child welfare. And in child welfare, you have the intake side, which assesses the facts of the reports we receive for abuse and neglect. And then during intake, if we decide that the family needs services and a case needs to be opened, then we transfer that case to an ongoing worker. And the ongoing worker then manages any placements that the children are in, manages family services, parent treatments, and also goes to court for that family. And in the beginning of my time as an intake worker, I went through the Child Welfare Training Academy and then began my work within an intake paired unit for last semester. I received referrals and investigated them to determine if there was abuse or neglect, and I have also helped caseworkers transfer their cases to those ongoing workers that I previously explained. And to transfer cases, we have a list that we have to go down that can include completing social histories for families, getting all the paperwork put together, getting birth certificates from the county, various different tasks. And this semester, I hope to continue my work with intake, but I also hope to learn more about other specialized units within DHS. In El Paso County, we have an institutional unit, kinship and adoption, sexual abuse, military, and just generalized ongoing. The most important skill I've practiced during my time with DHS is the critical thinking skills used when interviewing clients and assessing the well-being of the children. During my time interviewing clients, I've been able to work on the core social values of services, importance of human relationships, dignity and worth of persons, and social justice. During everyday interactions with clients, it's been important to focus from a strengths-based perspective, as many times referrals are misunderstandings or the family is under severe stress due to various issues such as incarceration, lack of resources, or mental health in either the parent, the child, or both. When working with families, it's important to ensure the safety and well-being of the children, but also help the family gain resources to mental health treatment, childcare, parenting classes, and many other services. Most times, people have a bad connotation of DHS, and it's a struggle to gain rapport with the family. But learning how to engage with the family and embody the core values of social work is imperative with our clients.